I decided to use research which is trying to evaluating the impact of sex, less gender, on inflammatory processes in the body. We were inspired by the data which came from epidemiological research, where it was shown that asthma during childhood was more frequent in male children, but then during puberty and adolescence, the bias changes towards female, and in adults, it's more prevalent in female. On the other side, already mentioned, local allergic rhinitis has also female predominance, at least from the population from Malaga, where it is most frequent. Then there were some studies showing the sensitivity to irritants, and airway hypersensitivity is more likely to happen in a female population. And from the epidemiological data, it's also clear that chronic rhinosinusitis with 8 nasal polyps is more common in female. Most of the bigger studies confirm that, and also the pattern of symptoms in chronic rhinosinusitis without nasal polyps is also different between female and male. Female have more pain and fatigue, and male patients have more obstructions, and male have also higher Lund-Mackay score. And then 3 diseases which don't belong directly to our, this is migraine, chronic fatigue syndrome, and fibromyalgia, which are showing that pain syndromes are also more common in female, which confirms also the data which we have for chronic rhinosinusitis without nasal polyps. If we look at comorbid allergic asthma and rhinitis, these are the results of meta-analysis, which is showing that in the early life, male gender is prevalent, then at adolescence, the prevalence moves towards female, but then it goes back in the adult. But this is only regarding allergic asthma. But in general, asthma in the adult population is also more frequent in female patients. And then we wanted to see, as you've seen, I mentioned migraine and chronic fatigue, and also fibromyalgia, which are also regarded as a disease which may be mediated by neurokines like substance P or carcinogen-related peptide. And we hypothesize that from the other one side, we would like to see whether this Ig-mediated disease may be more prevalent in adult women, but not in children, female children, which may suggest that estrogens may play a role. And on the other side, we would like to see why the disease where neurokinins may be important would be also more prevalent in female. So we first looked over literature on the relationship between mast cells, which are a key cell of the early phase of allergic reaction, with estradiol. There are receptors for estrogens on mast cells, and these are 3 citations which are related to allergic reaction in mice related to gender, and it was shown that actually levels of Ig are higher in female mice than in male mice, and when you do overreactomy, the severity of inflammation decreases, and also with tamoxifen, which blocks the effect of estrogen. So it seems that estrogen affects the allergic reaction, or makes allergic reaction stronger. And on the other side, we wanted also to check the interaction between estrogens and substance P, also the animal experiments. So we have also found that estradiol upregulates the substance P release after formalin injection on one side, and then after different irritant reaction also in rats, it was found that it would be more exaggerated in female rats than on male rats, and also that it is dependent on the sex cycle, which also suggests the effect of estrogens. And also estrogens may upregulate TRPV1 expression in rats, which is also related to substance P release. When we come to human models, then we see that this gender difference is not that easy to show like in rats. And when we were looking through that, we have seen actually that inflammatory bowel disease and dental pain would be the models where this is shown also, but it's not as explicit as in mouse experiments. We could not find respiratory studies exploring the substance P concentration in tissue secretions. So these experiments are actually showing that only the prevalence is changing from the early childhood through adolescent to adult age, but it didn't show differences which would be significant in neurokinase release. When we go back to rats, actually guinea pigs, then a study again shows that females have also different receptor for neurokines, so NK1 receptor and substance P release in inflammatory bowel disease in guinea pigs is different between female and male guinea pigs, where female guinea pigs have higher release from substance P. And finally, we go back also to human study, and this would be like sort of evidence-based study, which they show that NK2 receptor blocker heals or protects or significantly reduces the inflammatory bowel disease in females, but it does not do that in male. All of these which I told you, which may be a bit complicated for ENT, suggest that we can hypothesize that there is interaction of allergic reaction through mast cells, of substance P release, which is neurogenic inflammation, and gender. And we tested that in one experiment, which has a small positive result. It's not an evidence-based study, but anyway. So first we hypothesized that interaction between sex hormones, mast cells activation, and neurokines result in different response, both in symptoms and inflammatory neurogenic response. And we did a series of nasal challenges to show that and measure different concentrations of different mediators. So we evaluated gender differences in 25 patients, with 13 were male, 12 were female, who were sensitized to ragweed or grass or both, and they were submitted to nasal provocation out of season, and they were challenged with allergen, and then 24 hours after that with histamine, and 48 hours after histamine, they were challenged with hypertonic saline with 2% concentration. Here is the scheme of the experiment, which shows also what I have shown you. And on the lower part of the slide, you see that we were collecting nasal lavages, we were collecting tears, and measuring concentration of tryptase, which is a muscle marker, ECP as an eosinophil marker, and substance P concentration in nasal secretions after challenges. And what is the most striking difference is that substance P after allergen and 2% hypertonic challenges show different behavior. I will actually go down to show you, because maybe you will not be... Mogu dobiti mikrofon? Radio. So here is the male graph. The male graph shows that median slightly changes, which is insignificant, after a hypertonic saline challenge, and it's almost the same, the median is almost the same after the allergen challenge. In female, you see baseline lavage, and then you see after allergen, median slightly decreases, but then significantly increases after hypertonic saline. When we compared the concentrations of substance P nasal secretions between male and female after hypertonic challenge, it is significantly different, but what is most striking difference is the difference after allergen and hypertonic saline challenge, which actually was highly significantly different, which suggests both that female release more tryptase, which degrades substance P, but still substance P is released in higher concentration and increases after hypertonic challenge, which induces substance P release. Also, we looked at the symptoms, and the delta VAS, which means the change in visual analog scale score, shows only increase or significant difference between male and female in burning sensation, which is actually attributed to higher concentrations of substance P. And we didn't find differences between tryptase and ECP in male or female, but we can say that it showed tendency that female have higher tryptase and male have higher ECP. And finally, we come to the conclusions. The results suggest that female have stronger neurogenic response than males, and after challenges, especially hypertonic saline. They suggest also interaction between female sex hormones and mast cells, which influence the level of neurogenic inflammation, because mast cells release tryptase and especially chimeras, which degrade substance P. So allergic reaction actually decreases neurogenic response in female more than in men, because they have more degranulation. And we must say that the way how we measured substance P without protease inhibitors did not show real levels of substance P release. So substance P concentration is altered by mast cells protease. Thank you very much.
Thank you for excellent presentation. Only one question from the audience. No questions? One question from myself. Is your presentation harmonized with Istanbul Convention?
No. But I can say that we published these results actually in a Journal of Medical Hypothesis, which you may tell from the content. And you can go into the data in more detail, because I know it's complicated to show, but I wanted to warn that we should adjust our results for male and female when we do research, because they are influenced by gender.
Thank you. Thank you, Livije. No more questions.
I was actually going to ask a question, if that's okay. Yes. So this is interesting data, and I think that, you know, as you mentioned, there's a gender difference between migraine sufferers, female and male. And we now understand that many of the headaches that were previously considered sinus headaches fall into the migraine category. Do you think that the findings in your data have any translation into that arena?
Of course I do. I mean, if we have 300 patients in this study, we would be very proud. But I think that 25 patients is a too low number. We can, by chance, got statistically significant difference, but I believe. I can tell you that migraine in people who had gender change surgery increased in people who had this estrogen supplementation to become female for 3 to 4 times. So